has a large facial swelling. This is a Be Kind to Pets veterinary educational video sponsored by Toa Payoh Vets. Three years ago, the owner's family vet did not want to remove the lump. He said the dog was too old for anesthesia. 2 weeks ago, the family vet prescribed medication, as he said that the dog was too old for anesthesia and may die on the op table. However, the lump grew bigger.
Has it got regular dental?
No.
No.
Last round was 3 years back.
Oh, okay. We'll do. No, it's alright. I still hit.
Yeah, I think he wants you.
August 24, 2014. The lump below the right eye looks like a carnaissal tooth abscess. And we will check later inside the room. Yeah. It's 15-year-old. How long has it appeared?
Sorry?
How long has this lump appeared?
6 months, 7 months?
6 or 7 months. So the last dental was quite long ago.
11 years old.
And I opened the mouth, check the mouth first. He doesn't bite right. So I don't know whether it's painful, it's hard to tell. Now this one, there are two possible. The diagnosis of malar abscess.
Dr. Singh has treated several similar cases. As you can see, the location of the lump is below the eye and above the upper fourth premolar. In case 5, the abscess had ruptured, revealing the cheekbone. In case 8, the owner delayed treatment, allowing the rotting of the cheek muscles. In case 10, the family vet just prescribed some antibiotics. However, Dr. Singh's palpation showed that the lump was soft.
How long was it, this swelling?
About 7 months.
7 months ago. 7 months duration. Now just feel it. Let's see whether it is carnaissal tooth or not. Pretty well, of course, it's a tumor. And the other is abscess from the tooth.
Okay.
So
A pre-anesthesia health check. For a dog to undergo anesthesia, the dog needs to have healthy heart, healthy liver, and healthy kidneys. Laboratory tests to screen the dog's health include an X-ray of the chest to detect pneumonia and enlargement of the heart, an X-ray of the carnassial tooth region to detect bone and teeth infections. However, to save medical costs, these tests were not performed.
the blood test is coming now. As you can see, the main thing, glucose is okay, so there's no diabetes. Then now the liver, there's a bit of increase in the enzymes like AST. And this one is sometimes occurs in old dogs, but you should be able to take anesthetic. Now this is the one worrying, is the nearly 5 for the calcium in the blood. Now normally there will be something wrong with the parathyroid glands, whether there's a tumor or an infection. It's hard to say. Now below the kidney the profile is the urea is high, but the creatinine is normal. This is good because the creatinine is the one which is important for kidney function. It's within the normal range. So after that we go to the blood cells. Now you can see that actually this dog has very good blood cells. All the normal values that came up, but the dog is coughing yesterday. So he was coughing before, so.
No, not as much. It's only maybe twice a day.
But it was coughing before, so right?
Yeah, occasionally only when he lies down. Very okay.
When he lies down.
Yeah, and usually one cough, that's it. It doesn't cough
Previously, one cough. Occasional coughing. For how long? For 1 year?
No, about maybe 3 months.
For 3 months.
3 to 5 months.
3 to 5 months. But appetite is still okay, right?
Yeah.
And other than that, he can't sleep, right?
Yeah.
And the green discharge from the eyes, both eyes, right?
Day 1, 24th August, Dr. Singh prescribed heart medication and antibiotics. Blood sample was taken for testing. Day 2 night to day 3 morning. The owner complained that the dog was coughing continuously. Dr. Singh suggested that the owner increase dosage of fusilade.
Today is Tuesday, 2
Day
days
3
ago, I
morning.
saw
The
this
dog was not coughing. Came for
15-year-old
checkup
male
on the
dog
26th
with
of
a
August
swelling
2014.
on the cheek.
The coughing could be due to heartworms, thus the owner requested for a heartworm test. Thankfully, the dog was not suffering from heartworms. The owner was still very worried. The blood test revealed that the dog has healthy liver and kidneys. Dr. Singh's examination revealed that the dog had a murmur, hence anesthesia may be risky. The owner decides to give informed consent for the surgery to check the dog's carnaissal tooth and do the dental scaling. Advice for old dog anesthesia. Isoflurane and oxygen gas are the safest anesthesia. The duration of the anesthesia should be short, preferably less than 15 minutes, to minimize the risk of death on the op table.
More flow. Let's increase the flow. Talk about isoflurane. Isoflurane gas, yeah. And normally this dog is quite weak, so it should be quite fast. Started at 9:50, yeah. It goes down and pull the teeth out. The one, put the premolar floor, and then that is because he has got serious heart murmurs, so it's better not to go long. Short while I might be to die. Old dogs are like this. Try to be very short as possible. In fact, 1 minute is better than 15 minutes. The heart can't take it. He also got eye discharge. You see, he got red eyes.
Oh no, it's swollen.
So the infection, and then he's got cataract, so it's hard to see for him. Probably got ear trouble. Let me see. So 9:52, 2 minutes already. Still blinking there. You can see he's still blinking. Okay, now I'm going to pull out. Okay, then this is a tooth. It might not be easy to pull out. It might still be solid. That's why I suspect it's still solid now. Maybe the other one. It might be a tumor for all we know. So it's a cyst. There's a cyst. You see, this is a cyst. It's like a diameter.
There is cyst. The lump is a cluster of cystic cells. Cysts are closed sacs that contain water. If the sacs contain pus, they are called abscesses.
I might try. We don't know whether the cyst and the thing connected or not. We don't know. Got it, the cyst?
Yeah.
Take photo. Give the owner the seal, where is it? No more already. Put a piece of paper. The right upper, the swelling below the right eye is actually a cyst because there is no connection to the sinus. So by using a scalpel to lance it, we can see that there are small bubbles which you saw translucent. So it's a good news. But still the bad breath and the bacteria, you still need to scale the teeth fast. You can see he's got very strong teeth, which I'm surprised. Strong teeth. Very strong teeth. You can see that his teeth are really solid. That's because he's well looked after by the lady owner. And the dental should have been done earlier on because the bacteria went to the heart valves. After he went to heart valve, this fellow got heart murmurs. There's one reason. The other reason, of course, is due to aging. And so the dog coughs and coughs like an old man, dry cough. Then when he lies down, he coughs. Those are the signs of water in the lungs. And to get the water in the lungs, we have to use the furosemide tablets. And it takes time for the furosemide to act. So that is the reason. So we scale the one below and then almost finished already inside. Just only gas anesthesia, only 5% isoflurane plus oxygen only.
Day 4, 27 August 2014. Update. The dog is coughing less. There is no more eye discharge as the owner had applied antibiotic eye drops given by Dr. Singh. The facial wound is healing well after the cyst removal. The dog is continuing with his heart medication. The dog's treatment had been delayed by 3 years. This unfortunately increased anesthetic risks very much. The diagnosis of the facial lung looked very much like the carnaissal tooth abscess. The lump was below the eye and above the fourth upper molar. Veterinary cases are full of surprises, therefore careful examinations are important to prevent misdiagnosis. To minimize anesthetic risk, take a health screening which includes a blood test and x-rays. Use gaseous anesthesia without sedation. Keep the duration of anesthesia as short as possible, and have an experienced vet assistant monitor the anesthesia. To the owner, the dog is family, hence his health is of utmost importance. The family vet did not want to take the anesthetic risk of the dog dying on the op table. That would ruin his reputation. In this case, informed consent and pre-anesthetic health screening should be performed to assess the risk involved. Then the owner has to decide. Informed consent involves awareness of the risk involved and the possible repercussions.